Hi, Steve Lynch, licensed massage therapist, and I'm talking to you live from Limestone Therapeutic Massage in beautiful Newark, Delaware. What's up? I want to talk to you today about a condition that a lot of people incur in their health walk. This is called TMJ disorder, or as we know it in the therapy business as temporomandibular joint disorder. Now, what exactly is TMJ? And where is TMJ, more importantly? Well, TMJ, temporomandibular joint, is right here. Yeah, it's the jaw hinge, baby. It's what helps us chew, okay? And the condition itself is actually a wearing down of a little disc, a little cartilage disc that's in this joint structure. And what happens is it wears down unevenly so that one side becomes slanted down on this disc, this joint kind of slouches down, and it can affect the musculature and the connective tissue around the joint structure itself, and it can actually affect the jaw and the neck muscles. So with TMJ disorder, we can expect clicking, jaw sticking, wicked headaches a lot of the time, okay, and some pretty severe neck pain. And that's just some of the prizes you get with TMJ. So what's the solution to temporomandibular joint disorder? Nasty condition that it is. Well, there are some surgical solutions. Your oral surgeon, your orthodontist, or your dentist may recommend oral surgery, in which they can cut you open and do some things in there, shave some things down, make everything seem and appear nice and equal. And then they can sew you back up and ice you down after you're all nice and sutured up. And there's a nice recovery period. There's a little bit of pain with that. And the recovery can be painful, okay? It can also be a successful solution, at least in the short term. You know, and your chiropractor will also want to get in there and do a little adjustment around that particular joint structure. Now, both of these can seem successful, but as I mentioned in the first, it's for the short term. Now, when you have temporomandibular joint disorder, man, you want that stuff gone. You want it out of there, not just temporarily. You want that stuff gone forever, right? Well, there is a third solution, okay, and that deals with your clinical, medical, or orthopedic massage therapist, like we have here at Limestone Therapeutic Massage in Newark, Delaware. And what we do is that we address the inequality of the musculature, the mastication muscles, and the connective tissue surrounding and operating that joint structure. And of course, your therapist, when this happens, you're going to be wearing some surgical gloves. He or she might don their surgical gloves and be working inside the mouth on muscles like the medial and lateral pterygoids and the masseter and the buccinators. And you don't need to really know all those names of those muscles just yet, but what you need to understand is that the cause, the primary cause, if it's not an accident, catastrophic injury, or any kind of orthopedic condition like that, it's generally caused by things like, hey, let's say that you get a tooth out and you don't have the money to replace it with an implant or some other type of situation. So what you have here is you have an unequal chewing situation. It can be caused by other challenges too, orthopedic challenges, but primarily it's because of an unequal length of the mastication muscles, okay? And the muscles become shortened, they become adhered to the fascia. Remember that stuff we talked about in an earlier video. Fascia is kind of like the saran wrap of the body. Okay, it covers everything, all the muscles and tendons and ligaments and bones and organs. So it stands to reason that it would cover this too. And when it gets adhesions built up, now what you have is you have a shortened muscle which is not going to lengthen itself back out by itself, okay? So this is what your clinical or your medical orthopedic massage therapist will do. It's what we're trained to do, okay, is work with the musculoskeletal system in a way that your surgeon or your chiropractor may not, may not be able to. There are some chiropractors who understand the value of working with the musculoskeletal system for these types of conditions. But by and large, it's guys like me and the women and the men that do the orthopedic medical massage, um, like here at Limestone Massage Therapy in Newark. And we take care of those situations, okay? We get those muscles lengthened back out. We make sure that there's equality of the musculature and that your joints are opening and closing, your jaws opening and closing correctly without that clicking and sticking, without the uneven type of movement. And then we might also give you some type of little exercise to do that's going to help you keep those jaw joint muscles nice and equal. So the long or the short is, if I could say it that way, that it's the inequality that produces the challenge with TMJ disorder. So once you eliminate that inequality, the jaw, unless there's excessive damage, is going to start working normally again, and the teeth will wear back down in a way that they're supposed to with equal movement of the jaw, and the neck pain will fade away happily and the headaches will cease. And so that's kind of what I want to say about TMJ disorder in general, is that it's not really a hopeless kind of situation, and you don't have to live with pain the rest of your life, and you may not have to go through an extensive painful surgery and recovery, and you won't have to get it adjusted by your chiropractor every other week, okay? And it's about self-maintenance after your massage therapist gets in there and does their work, okay? There are exercises you can do to keep that jaw working correctly. The biggest problem with TMJ disorder is that it's an unknown player for most people. They don't really recognize the fact that, hey, I've got joints back here and they have discs, and you know, the average person doesn't really understand that those things have to be equal and linked to operate properly. So they just think, well, I'm just going to do whatever, you know, whatever my dentist, whatever my surgeon suggests for me. And what I'm telling you is that it doesn't have to be that way, and you know, you can be pain-free. And in many cases, not only with TMJ disorder, but with all kinds of maladies, all kinds of challenges with the human physique, your massage therapist, your clinical and medical orthopedic massage therapist, your NMTs, they understand the mechanisms of the body, the functionality. They understand how it's designed to work, and they can pretty much get it back in that working order. So give them a chance, okay? And realize it ain't all about the surgery, and you don't have to be in pain for the rest of your life. You can do some real simple things that make good clinical sense to your body and for your pain-free functionality. Okay, Steve Lynch, and if you want to talk to me or find out information about me, you can hit me up on my site, stevelynchlmt.com. Or you can find out about me. You can find out about what we do here at Limestone Therapeutic Massage in Newark, Delaware at limestonemassage.biz or .org. And this is Steve Lynch again saying, have an awesome day.